Nursing care if labor is prolonged beyond 12 hours or other complications are present, transfer the patient to the hospital. Nursing care in prolonged labor refer chapter prolonged labor, cervical dystocia, rigid cervix, injury to the cervix result in the fibrosis and may be caused by a previous cervical cavity amputation or inflammation at the time of no case is discovered. On examination, the presenting part is deeply engaged, the cervix is rigid, thin, and well applied to the presenting part. Although good uterine contraction are present, there is no progress in dilation of us. A prolonged labor follows the cervix become immature if labor pain continues. Extension of tear of the cervix occur treatment complication of prolonged labor. For example, dehydration need attention and treatment. Delivery is undertaken by C-section. Prolonged labor, the duration of normal labor is 12 to 16 hour and about to 6 to 10 hour at multipara. When labor is prolonged beyond 24 hour and term prolonged labor, although it is reasonably safe for the labor to continue for 24 hours, the patient need on obstruction advice after 16 hour. If dangerous for the multipara, the labor for the 12 hour, it may lead to rupture the uterus. Nursing care labor record must be carefully maintained. This includes the time of onset of uterine contraction, rupture of membrane, and full dilation of the cervix. The interval between uterine contraction and fetal heart rate is recorded. Number two, maternal condition, temperature, pulse, blood pressure, and inspiration is recorded for the frequent intervals. Intake and output record maintained when labor exists 16 hours and the pregmatic urine is enriched by acetone and albumin. Diagnosis in pregnancy, history of trauma, disease, obstetric history in multipara. There may be history of prolonged or difficult labor, stillbirth, neonatal death, indication and normal pelvis. Height, if a patient is less than 5 feet in height, contracted pelvis should be suspected. The patient should be observed while she is walking, is not abnormally of posture or gait. Often in hospital, the patient is already on table for the examination. Abnormal gait symptom is missed. Examination in the pre-pampera, the head of the engaged the pelvis at 37 week. It has not occurred. Contracted pelvis is suspected and the patient referred to a doctor's. Diagnosed in the hospital, the patient is home to suspicion of contracted pelvis exists. Admitted for the investigation. Clinical assessment of the pelvis is undertaken by vaginal examination. The diameter for the pelvis and measured digitally. Ultrasound pelvimetry displayed the shape of the pelvis. The diameter is measured on the minor contraction detected. Treatment of contracted pelvis, the obstruction may be caused. The pelvic method for the delivery, premature indication of the labor, and the minor pelvic contraction of pure destruction and reduced labor around 37 week and hope to smaller baby may be born vaginally.